Hi, everybody. Um, Good evening, or afternoon, or morning, wherever one might be listening from. Um, I did a video yesterday I started to do a video, I should say, on treatment for the treatment I went through for heart failure. And I didn't get very far at all. I just got to the very, very beginning of the story of how I was diagnosed and the very beginning of my treatment journey. And so now I wanted to finish that up um, and go forward from there. So uh, yesterday I talked about how I had the cardiac catheterization, and the doctor I was seeing at the time called in for a Lasix diuretic before I even left the hospital for the test from the test, and so on and so forth. So that's on yesterday's video, and how I started seeing a brand new doctor, a heart failure specialist. In fact, an advanced heart failure specialist, who told me, of course, looking at my records, of course you're in heart failure. And so I said, I really want to go at this. Like, I really want to do whatever you think we can do to be better, to have my life back, maybe go back to work and the whole 9 yards. I really wanted, I wanted my life back. That's what I wanted. Or at least the way it was at the time, Anyway, so he treated me quite aggressively. I was on the amlodipine and the Lasix at first, on low doses of both, and he gradually put me up on a higher dose of the amlodipine, which again is for blood pressure. And I was unable to tolerate the dose. I mean, it was still a low dose. I think I went from 5 to 10 milligrams. 5 milligrams was working to lower my blood pressure, but 10 milligrams had me nearly passing out. But I tried for a little while to keep it going, but I couldn't. I was really literally coming really close to passing out, to actually seeing black before my eyes. And the diuretic, he increased the dose of. So I continued to get rid of the fluid. He wanted me to get rid of the fluid to where I was just at the level of almost dehydrated, but not quite dehydrated. So really close to there. And he wanted my blood pressure, the systolic number, the top number, below 100. And he would have liked to see it between 90 and 100. But for whatever reason, my body cannot tolerate quite that low. I do better, at like 110, somewhere around there. But anyway, we tried to work that out, and it was difficult. I was having lots of side effects, particularly from the blood pressure medicine. And then, in addition to the just heart failure, that's as if that's not enough, and also partly because of my congenital heart disease, I also had pulmonary hypertension. That's why the right side of my heart pressures were high from the catheterization. So I had read about a study being done back at that time. We're talking, you know, 2012, 2013, in that time period, being done on what's called sildenafil. Some people know it at, what's the other one? Sildenafil is, It's the little blue pill used by some men who have erectile dysfunction. I can't remember the name of it. Anyway, that medication was initially to be used for heart conditions, for blood pressure and heart conditions. And then they found out a side effect of it was helped with erectile dysfunction. Anyway, they were doing a study back then to see if if that medication could help with heart failure and pulmonary hypertension. Viagra, that was the name of the little blue pill, Viagra. But this pill, sildenafil, which is just the trade name, Revatio, not the trade name, its chemical name basically. Revatio was the trade name used for that drug used for pulmonary hypertension. So I asked him about that. He said, let's give it a try. So he started me on that twice a day, like 20 milligrams, one in the morning, one at night. Didn't do a thing. Like literally nothing. So then he put me on it 3 times a day. And then I had to go through the whole insurance company thing because it's not supposed to be given 3 times a day. It's only, anybody who's had a heart failure treatment knows that story. So then he put me on 3 times a day. Didn't do much of anything. Then he put me on 20 milligrams, 2 tablets, 3 times a day. And after a couple days of that, I literally, of course somebody would contradict me, especially a doctor. I literally felt like I could breathe. Like I could breathe again. I felt like a weight lifted off my chest. I really did. And literally in my lungs, I felt like I had room to breathe. I know it kind of sounds ridiculous, but it's what happened. So I really felt a big difference with it for a good while. So I was on, those 3 medications basically, and then and then he put me on spironolactone, which is a very mild diuretic, but it also has some other things to do with hormonal balance in terms of water and retention and so forth. So he put me on that. So I was on a lot of medication and taking a lot of pills every day. There were others, I just can't off the top of my head think of them right now from back then. Anyway, with the spironolactone, I developed a lump in my breast tissue, in my breast. And I actually had to get a mammogram. And it was just enlarged breast tissue. That's all it was, which is a side effect of this spironolactone, can have that side effect. So he took me off that and put me on, it's called a Plaranon, which is a similar medication to which I'm on to this day. As time went on, I'd say in a year, but during that year, particularly the first year of treatment, it was really had a rough time. I had I'm very sensitive to medications. I had a lot of side effects. I had terrible diarrhea on and off. Really bad diarrhea. Like I was so afraid to go out to eat at a restaurant for fear that I might not make it home without going in my pants, which happened once. Yes, I remember it clearly to this very day. And it just made me sick and feel tired and, the whole 9 yards, sick to my stomach, on and on and on. And we kept going and kept going and kept working at it. It was at least the first year, maybe 1.5 years or so. And then a new drug came out that had been in a study called Entresto. And it was like the miracle of heart failure drugs just was discovered, is how it was, really a big deal, was on television commercials and all that stuff. So I said, so he said, well, we could try you on Entresto. Great, let's try me on Entresto. So he put me on, there's 3 levels of dosages. Again, getting your blood pressure down was a big part of it, keeping your water down, so on and so forth. So he put me on the lowest dose, and I'd say after a couple of weeks, maybe a month, I felt a difference. I absolutely felt a difference. I had a bit more energy. I could walk further, wasn't getting as short of breath, and I felt like I didn't feel anywhere near normal, but I felt better than I was feeling. I still couldn't go back to work, but I was feeling, what really happened was I was going downhill fast, and with all this medication and Entresto put the brakes on, and I stopped going down, and then I kind of evened out. And I evened out for a good 3 or 4 months, and I felt pretty stable. Like I said, I didn't feel great. I couldn't go back to work, but I felt stable. It wasn't getting worse. That I could tell you, I wasn't getting worse. And that felt really good, to not be getting worse. So the Entresto, after about 4 months, I started feeling worse again. It just wasn't cutting it like it was. But I just thought, okay, I'm getting worse, a little bit worse, slowly, not hugely, but a little bit. He said, let's just, keep watching this. And I was on it for quite a while at that level, the first level, quite a while. And then finally, because I continued to get, like I said, I was good for a couple months, and then I started drifting down again. So he put me up to the second level dosage, the middle one. And at first, I had a lot of trouble with the blood pressure too low, the feeling really lightheaded, all that kind of stuff. But I stuck with it. Hoping it would help. And after a while, some of the side effects got better, or not as intense. And so we stuck with that. And I wouldn't say I got better, but I again plateaued. That's what I'm trying to say. I was going down again even after I had plateaued, then down again. And then I plateaued again on the next dose level of the Entresto. And I think by this time too, I was having a lot of problems with arrhythmias. A lot of, it's called atrioventricular AVNRT, non-reentrant tachycardia. So I was having a lot of it. Like it would start out of nowhere, and this arrhythmia, my heart would be like go suddenly, just shoot up to like 110, not high enough for the defibrillator, and it shouldn't have even done it anyway, because it wasn't VTach, but high enough that when I would have these episodes, I couldn't do anything. I couldn't do anything. I had to lay down until it stopped. And often it did. Sometimes it would last 5 minutes. Sometimes it would last a half an hour. One day it lasted 12 hours. 12 hours, which meant I was home in bed the whole time. To the point where I think that was the episode the doctor who sees me, the electrophysiologist, wanted me to come in to the lab, the electrophysiology lab, and what he did, because I have the defibrillator in, he can manipulate my heart rate with this. So what he did was sped my heart up. And that took me right out of the arrhythmia. And I was like, whoa, my heart's going fast. And then he stopped pushing, and I was like, oh, it's back to normal. He took me out of that rhythm after having been in it for over 12 hours. So I was having a lot of problems with that. So we were thinking of doing an ablation. He said, let's try one more thing. Instead of having to go for a procedure, let's try you on digoxin, digitalis digoxin, a very common, very old heart medicine that slows your heart rate down. The main thing that we were using it for, and it helped. It helped a lot. And in terms of that, I still get it. This was some years ago. I still get it, but not to the extent I was, because it was ruining. I mean, it was making it I couldn't go anywhere. It would start when I was out shopping, and then like, what do I do? How do I get home? So it was really throwing a wrench in my life, big time. But with the digoxin, it really quieted the problem down. So that was another medication added. So during that time, I was, and again, if I got sick with the flu, if I got anything, I would drop down again and then slowly come back up, but not as far. So I was still drifting down, but not speeding down. So anyway, I'm going to come up to the present day, where I take approximately, I'm going to put a little bit of a thing, because I don't know exactly. I don't keep that close of a count, but about 20 to 25 pills every day I take. 20 to 25 pills a day. Now, some of those pills now are pain medicine. Some of the and I take 2 injections a week, which is for the rheumatoid arthritis. So I take a lot of medication. And I've been on that regimen, all of that, for about 2 years now, including the rheumatoid arthritis medicine, and then the pain medicine started within the last little over a year, I'd say. So even with all that, I continued to get worse, and started again to get kind of rapidly worse. Then they found out my valve, the valve that I got replaced in 1998, not replaced, placed in 1998, went bad. 24 years. Now they usually last 10 to 15. So mine lasted 24 years, which was amazing. So I had to go in and get a procedure where they go through your, like a catheterization that goes through your arteries, your veins, with a tube, and go into your heart, and they actually put a valve in and expand it where they want to put it in the pulmonary valve. And it went in, and inside the valve that was already there, and opened it up, but left the new valve in. And for a while, that made quite a difference. For a while, that made a really big difference for, I'd say, 6 months. And then it wasn't making that big of a difference. And the valve was okay. So here's my point with all of this. Finally, right? I have had every treatment, just about everything, except perhaps a heart transplant, which I wouldn't qualify for because of so many things. My age being one, because of all the scar tissue from my surgeries, my lungs, excuse me. So short of a heart transplant, I've done everything there is to do. Everything there is to do. I worked at this for 12 years. 12 years. Since 2012. I've been pushing and pushing. I know some of the doctors I've had think I'm the biggest pain in the ass because I'm like, I still don't feel well enough. What else can we do? What else can we do? What else can we do? And it's slowly but surely within the last year, maybe 9 months, I realized slowly I'm getting worse and worse and worse despite everything, despite all attempts. And that's when I started realizing, that's when I went for, maybe a year ago, a little more, I went to a palliative care doctor because I thought, I'm not going to get better. Finally, I realized I'm not going to get better. And I'm only going to get worse. And that's exactly what's happened. And there's no more this, no more that, try this, try that, go here, go there. Oh, that new doctor told, no. And I'm tired. Like I said before, I'm tired. I can't keep doing this. So that's why I decided, not very long ago, even though I'm on palliative care, basically in my mind on hospice, because I'm not doing any more extraordinary treatments, no procedures, period. I'm on the medicines I'm on because they help me to maintain some functionality. So in a way, they're comfort measures, which is what you're allowed to take. So if I went on hospice, they wouldn't take me off any of my medications. I went off one medication. I was on cholesterol medicine. I'm not on that anymore because I'm not going to live long enough for it to, at this point, make any difference. It was one less pill. But the rest, I need, even the rheumatoid arthritis medications. If I stopped taking one of them once because I just was like, I'm tired of giving myself 2 shots every week, so I stopped one. And after 4 weeks, I thought I was going to die. I could barely move. My joints were screaming. I could barely get out of bed. I mean, just because I was so stiff. And I started back on it, and, that improved. So those medications, as far as I'm concerned, are comfort. I know that I'm going to have to be on hospice eventually, for sure, for absolute certainty. Oh, well, unless I suddenly die, which is still a possibility. But if this continues going as it is, I will have to be on hospice. And again, as I've said before, the way things are going, I think it will be, like I said, I'd be surprised if I make my birthday, which is November. And yeah. And again, I'm okay with it. So I guess my point is, partly from my own mind, is that I'm not giving up. I didn't give anything up. I stopped beating a dead horse, so to speak. Realized and came to understand there was nothing going to make me better. Nothing. nothing going to take heart failure doesn't go away, and it progresses. That's the nature of heart failure. And it is a life-ending disease. And I just had to go, okay, well, that's my trajectory. Some people get heart failure and live for a year. The average is 5. The average is 5 years from diagnosis to death. Some people live 20 years. Some people live 30 years. I made it 12. So I feel like I have fought the good fight all my life with my heart from the beginning, working, with the surgeries and the whole 9 yards, all the stuff I have in me that doesn't belong to me, valves and metal, tubes and all this stuff. No, I fought the good fight, and I'm not fighting anymore. I'm just rolling with it now. And so I just wanted to put that out there for anybody else with heart failure or any other chronic disease, or even people with cancer. If you've tried everything and you're not getting better, in fact, you're getting worse, I guess my message is, if you decide you want to stop, that's not failure. That's not giving up. That's not being a coward. In fact, it's quite courageous to say, I've had enough. I've had enough. And I'm not going to get better. And I'm not going to put myself through this anymore. Because you can find doctors who will keep going. Keep going, keep going. Oh, yeah. But there comes a point for me where I can't do it. And I'm not going to do it. I don't want to do it anymore. The quality of my life is far more important than how long I live. So there you go. Another long one. Sorry. Really sorry. I may take a little bit of a break. A little bit. I don't know. I'm thinking about it because I'm looking at how many people are watching my videos, and not very much, to be quite honest. So I might just stop for a while until something changes. And if something changes, or maybe I'll just do it once a week or something like that. I'll see. It's just a thought I'm having, because I've made quite a few videos, and they're once in a while being watched, but really not too much. So I'd like to see some action, activity, And again, if even one person was helped by the videos I've made so far, I'm thrilled. And I'm not going to stop. I'm going to keep going with it because I want to. That's all. I want to. But I think what I'll do is just slow down. I don't have to do it every day. And just, when things happen, or just once a week, give a check-in. Okay? So, thank you again for listening. Hopefully this helps one person, I hope. And I really appreciate it. I really appreciate it. I mean that. Good night.